This study aimed to generate an estimate of how many people in Santa Clara County have been infected with the virus. And the way to find out is to try to see whether they have developed antibodies to SARS-CoV-2. We realized that the number of infected people is somewhere between 50 and 85 times more compared to what we thought, compared to what had been documented. Immediately, that means that the infection fatality rate, the chance of dying, the probability of dying if you are infected, diminishes by 50 to 85 fold, because the denominator in the calculation becomes 50 to 85 fold bigger. If you take these numbers into account, they suggest that the infection fatality rate for this new coronavirus is likely to be in the same ballpark as seasonal influenza. Of course, there is still a little bit of uncertainty about the exact number, but it's clearly very different compared to the original thoughts or speculations or preliminary data that suggested a much, much higher infection fatality rate. We also tried to estimate what is the absolute risk if you're less than 65, and we tried to compare that against the risk of dying if you drive your car over a given distance. In doing this, we tried to correct for the number of days that the pandemic is ongoing, so you can get an estimate per day. In many locations like Germany, the risk of dying from coronavirus until we did the analysis on April 4 is in the range of the risk of dying driving from home to work, or even less. If you think that COVID-19 has pretty much the same infection fatality rate as, let's say, seasonal influenza, one immediately would argue, well, do we really see this type of disaster as we have seen in some epicenters of the pandemic, like some cities in Italy, some cities in Spain, and several locations in the US, prominently New York City and the New York metropolitan area? And the answer is that for coronavirus, we don't have a vaccine. So hospitals that are very close to capacity, like Queens, for example, that tends to be a war zone even in summertime, if you get a very large number of people who come to the hospital with symptoms, they show up at the emergency room, they wait to be seen, probably they start infecting each other, they can infect physicians, they can infect nurses, they can infect personnel. This means that the battle moves in the most unsuitable battleground. Hospitals are the worst place to fight the war with COVID-19. We should have done our best to keep people away from the hospital if they had COVID-19 symptoms, unless they really had very severe symptoms, and in which case, of course, they needed medical care. So it is a serious problem. No one would deny that. But it's clearly not the apocalyptic problem that we thought we would face early on. We have data now that the infection fatality rate is much, much lower compared to our original expectations and fears. I think that there's no reason to fear. We have data. We have ongoing accumulation of data. We have eyes on the epidemic and its evolution. We can be we should avoid panic, and we can take rational steps to deal with the situation and hopefully even open up our society again with careful, gradual steps. Sweden was one of the countries that chose a less restrictive approach. It kept much of its society and of its economy open. It allowed most schools, kindergarten and elementary school and middle school to be open. It kept most shops open and bars and restaurants, although with some modest restrictions. It also allowed people to get together but not exceed a limit of 50 people. So in a way, it is very different compared to the draconian measures that were implemented with very fierce lockdown measures in other countries in Europe and in many places in the US. They have done fairly well. And of course, it is very difficult to compare one country against another because you expect to see large diversity in infection rates and also in death rates. Maybe you can compare Sweden against Switzerland, for example, that had very draconian measures very early on, and the death rate per million population is slightly higher, a bit higher in Switzerland compared to Sweden until now. No evidence so far, though, suggests that Sweden did something wrong. I think that they seem to have fared pretty well. They had a number of deaths. The number of person years lost was pretty small because almost all of these deaths were in people who were very frail and old and had very limited life expectancy. They never came close to seeing their health system crash. They always had plenty of reserves, at least until now. That might change in the future, and I'm watching that very carefully. But I don't think that we can blame the Swedes for doing what they did. Maybe we should congratulate them. I think that just saying that measures worked is very, very poor statement. It's an overgeneralization, and I think that we need to scrutinize very carefully which one of these measures worked, which ones did not work, and which actually may have done some harm. In principle, I think that we should not blame anyone for just acting ferociously and aggressively and saying shelter in place immediately. We just don't know what's going on. It was a very sound approach, but now we can be a bit more thorough, a bit more exact. For example, we know that suicides go up by 1% for each 1% increase in unemployment. And as you know, as of now, we're talking about 25 million people filing for unemployment in this country, and probably almost 10 times that many around the world becoming unemployed, and the number is rapidly increasing as we speak. We know that there's huge problems with other problems of common diseases like cancer and heart attacks. They can go up, or actually the trajectories of decrease that we have seen for many of these conditions are reversed, and they're not decreasing at the same slope or actually even increase in situations of meltdown. But I really worry that unless we manage to have a viable plan to exit from lockdown and shelter in place and reopen our world, the consequences will be far worse than coronavirus.